If you are above 65, you should take 4 of the 4 harmful vitamins every day. What if I told you that the vitamins you take each morning could be the cause of your gradual death? Seniors who use the improper supplements may be up to 40% more likely to die young, according to JMA. That is clinical data, not clickbait. Brain shrinkage has been associated with one of these vitamins. Another, which you probably take daily, raises your risk of heart failure, stroke, and nerve damage even at typical dosages. Your liver slows down around age 65. Your kidneys are no longer able to eliminate excess. You have more brittle nerves. However, these vitamins accumulate, damage your cells, and mimic symptoms that you attribute to aging. It's not age, though. It is preventable. In this video, we'll reveal the 4 vitamins you need to start taking every day and the 4 you should never take beyond age 65. A significant European study found that vitamin number 1 is associated with a 36% lower risk of death from all causes. So pay close attention to the finish. Tell me in the comments where you are viewing us before we start. However, we must first discuss the negative ones. Let's start with a vitamin that may seem innocuous, but over time, it can do significant harm to older folks. Vitamin A in retinol form comes in at number 4. It seems like vitamin A is one of the nice guys. It does, after all, help your skin, immune system, and vision. However, excessive amounts of vitamin A, specifically retinol, can silently accumulate in the body and cause toxic overload in those over 65, particularly those taking multivitamins or liver-based supplements. The majority of people are unaware of this. Vitamin A dissolves in fat. This indicates that, unlike water-soluble vitamins, your body retains it in your liver and adipose cells rather than eliminating it. Additionally, as you age, your fat storage alters and your liver slows down. Your daily intake of vitamin A builds up rather than simply disappearing. The buildup eventually turns toxic with mild symptoms: joint discomfort, lightheadedness, dry skin, and impaired eyesight. Even while you may believe it's simply age, chronic vitamin A toxicity may be the cause, particularly if you use more than 2,000 to 3,000 micrograms of supplements daily. Things worsen. Excessive vitamin A intake in older persons was linked to a 25% higher risk of atrial fibrillation, an abnormal heart rhythm that significantly raises the risk of stroke beyond age 65, according to a 2022 review published in the European Journal of Clinical Nutrition. It's time to think twice if you're over 65 and still using retinol palmitate supplements. Does your body require vitamin A? Not in this way, though. Foods that contain beta-carotene, a safer form that your body can manage, include sweet potatoes, carrots, spinach, and eggs. There is almost little chance of overdosing on beta-carotene, since, unlike retinol, your body only turns it into vitamin O when it needs it. Check the label to see if retinol is still included in your multivitamin. Over 700 micrograms per day for women and 900 micrograms per day for men can be harmful, particularly over an extended period of time. The best course of action? Choose natural sources from actual food instead than the manufactured one. Your first caution is that prepare yourself for vitamin number 3, which is considerably more harmful and frequently prescribed to elderly people without conducting the necessary testing. Third place, supplemental iron. Although iron is necessary, iron supplements might provide a hidden and gradual risk to elderly individuals. Iron may be doing far more harm than good if you're over 65 and still taking it as a precaution. Iron is typically thought of as a fatigue combatant. For anemia, doctors prescribe it. Often included in senior multivitamins, it is advertised as a remedy for brittle nails or fatigue. But after age 65, most individuals don't hear this fact. iron doesn't disappear. Your body no longer loses it as it formerly did. It accumulates. Iron is primarily stored in your liver, heart, and pancreas, in contrast to water-soluble minerals. Oxidative stress is the result of excessive iron over time. At that point, unstable chemicals begin causing internal organ aging, tissue inflammation, and cell damage. Additionally, it promotes the production of harmful substances, known as lipid peroxides, which have been connected to heart disease, cancer, and Alzheimer's. The issue is that very few elderly people genuinely require iron supplements. After puberty, men no longer lose iron. After menopause, women stop. You're probably getting more than enough iron from your diet, unless you have a known iron deficit or have lost blood as a result of surgery, ulcers, or long-term illness. Iron is found naturally in meats, beans, leafy greens, and even fortified cereals. You upset the equilibrium and cause long-term damage when you take a supplement on top of that. Iron excess symptoms are simple to overlook: heart palpitations, joint pain, exhaustion, or memory issues. It's frequently misinterpreted as aging. However, that extra iron is harming the heart, liver, and brain in the background. Additionally, high iron takes time to rectify and may already have caused damage, unlike low iron, which your doctor may rapidly fix. Stop taking any iron-containing multivitamins and consult your doctor. Request transferrin saturation and a serum ferritin test. You can use these to determine whether your iron stores are high. And if they are, you might need to cut back on red meat consumption and immediately cease taking any iron supplements. A wiser choice? Select iron-free multivitamins, particularly for elderly people. When you're young, iron may be beneficial, but when you're 65 and older, it's like adding gasoline to a fire that your organs can't fight. Are you prepared for the second vitamin? Even more prevalent, this one is frequently used daily by well-meaning elderly people, and it may be gradually weakening your muscles and bones without you realizing it. Second place, calcium as an independent dietary supplement. For many years, calcium has been a well-known brand. It's in almost every multivitamin marketed for healthy bones, every doctor's office booklet, and every senior bone health advertisement. However, the majority of persons over 65 are unaware of this. In fact, using calcium supplements alone may make you more susceptible to heart attacks, strokes, and severe arterial calcification. Not a scare technique, that. It is scientific. Although calcium is necessary, where it ends up in your body is more important than how much you consume. Your bones are like a sponge when you're young. Their rapid calcium absorption is aided by growth nutrients and hormones. However, the system slows rapidly after age 65, particularly in older males and postmenopausal women. Does too much calcium cause the bones to cease absorbing efficiently? It doesn't simply vanish. It enters your joints, soft tissues, and, most dangerously, your arteries, where it shouldn't be. Not many elders are informed of this. They believe that taking calcium will protect their bones, but without assistance, their body is unable to properly utilize it. It hardens arteries rather than strengthening bones. It increases your chance of stroke rather than preventing fractures. Even worse, taking calcium supplements can lead to constipation, bloating, digestive problems, and decreased absorption of other important minerals like iron and zinc. And your stomach won't absorb calcium properly if you're taking acid blockers for reflux, as many seniors do. As a result, you have poor digestion, no bone benefit, and increased heart strain. What is the preferable strategy, then? Consume foods that contain calcium. A safer, more accessible type of calcium can be found in leafy greens, sardines with bones, yogurt, almonds, and chia seeds. Food-based calcium is better absorbed and utilized by your body without the dangers of excessive supplementation. Additionally, it should be used in conjunction with vitamin D3 and vitamin K2, which assist move calcium away from arteries and into bones, if you require more. It's time to reconsider your approach if you currently consume a diet high in calcium, and your multivitamin still contains 500 to 1,000 milligrams of calcium. It's not just calcium that your bones require. They require mobility, balance, and appropriate direction. Keep calcium where it belongs, not where it hurts, for the sake of your heart. The most hazardous vitamin for seniors is number 1, which comes next. It is widely advised, frequently self-prescribed, and, when taken without testing, is closely associated with memory loss, muscle atrophy, and even mortality. First, heavy dosages of vitamin B6. Most folks are surprised by this one. Many people believe that vitamin B6 is safe and can be taken for energy, nerve support, or to clear up fogginess. Numerous multivitamins contain it. Physicians advise it. However, excessive amounts of vitamin B6 after age 65 can subtly damage your neurological system, weaken your muscles, and cause symptoms that appear to be aging but are actually poisonous. This is what most people overlook. Since vitamin B6 dissolves in water, it should be harmless, right? The surplus should be flushed out of your body. However, B6 is not like other water-soluble vitamins. It accumulates in neural tissue when consumed in significant quantities, particularly via supplements, and it turns neurotoxic after that. This indicates that it begins to harm your sensory nerves, resulting in burning feet, tingling, numbness, issues with balance, and even weakness in your muscles. Many elderly people who exhibit these symptoms are misinterpreted as having old age or diabetic neuropathy when high-dose B6 is the true cause. Although 100 milligrams per day is the stated upper limit for vitamin B6, studies have shown that even 50 milligrams daily over time can cause toxicity in older persons. Additionally, a single serving of many energy boosters, brain tablets, and nerve support solutions contains 100 to 250% of the daily limit. When you combine those with your multivitamin and foods that have been fortified, you may be unknowingly raising your toxicity levels. Additionally, healing is sluggish once nerve injury starts. Due to slower metabolism, decreased liver clearance, and pre-existing diseases like diabetes or thyroid imbalance that already strain the neurological system, seniors are particularly at risk. What is safe then? Vitamin B6 is still necessary, but in moderation. For men and women, the recommended daily intake is 1.7 milligrams and 1.5 milligrams respectively. Foods like chickpeas, tuna, turkey, bananas, and fortified cereals can provide you with plenty of that. You do not need to take large amounts of vitamin B6 supplements unless you have been diagnosed with a clinical B6 deficiency that has been verified by blood tests. It's time to switch if the amount of B6 in your multivitamin or nerve formula exceeds 5 to 10 milligrams per serving. To have your levels checked, switch to a senior-specific formula or see a physician. More is not better when it comes to B6. More could result in irreversible nerve damage after age 65. That concludes the list of 4 harmful vitamins that elderly people should never take without a doctor's advice. Let's now discuss the 4 most important vitamins you should take every day after the age of 65, in order of least to most important. Fourth, magnesium that can be absorbed. Among the most crucial elements for aging, magnesium is also one of the most neglected. Your body's magnesium stores have probably decreased considerably by the time you're over 65. This is due to the fact that as you age, your kidneys waste more, your absorption decreases, and several common medications, such as blood pressure medications, diuretics, and acid blockers, further deplete your magnesium stores. The outcome? Weariness, cramping in the muscles, insomnia, anxiety, erratic heartbeat, and even insulin resistance. These symptoms appear so gradually that they are frequently confused with aging. However, seniors frequently report better sleep, balance, fewer cramps, and even more alert thinking after their magnesium levels are restored. The body has more than 300 enzyme systems that depend on magnesium. It helps maintain blood sugar, improves nerve and muscle function, and controls blood pressure. Additionally, it maintains a regular heartbeat and healthy brain function. Indeed, a lack of magnesium has been directly associated with a higher risk of atrial fibrillation, dementia, and even type 2 diabetes. However, not every magnesium supplement is effective. Magnesium oxide is one of the many common ones that are poorly absorbed and frequently cause stomach problems. More bioavailable versions, such as magnesium glycinate, magnesium citrate, or magnesium malate, are the best choices for elderly people. These are more easily absorbed by aging stomachs and are kinder to the stomach. It is recommended that seniors take between 250 and 400 milligrams daily, depending on their present health and diet. Additionally, foods like leafy greens, avocados, pumpkin seeds, almonds, and black beans might help you increase your magnesium intake. However, because the magnesium content of food has decreased due to soil depletion, supplementation is frequently required, particularly if you are on several drugs. Next up is vitamin 3, which helps your immune system, powers over 1,000 cellular processes, and may significantly reduce your risk of infections and cancer after the age of 65. To ensure that you don't miss any more videos like this, please hit the bell symbol, subscribe, and like the video if you have enjoyed it thus far. Third, the benefits of vitamin D3 extend beyond bone health. It is among the most important hormones in your body. Technically speaking, it is a hormone. Additionally, your natural capacity to generate it is reduced by more than half beyond the age of 65. This is due to your skin's inability to effectively convert sunlight into vitamin D. Additionally, your blood levels may drop without your knowledge if you live in a northern latitude, wear sunscreen, or spend more time indoors. The repercussions are severe. Fatigue, bone weakening, muscle weakness, weakened immunity, and an increased risk of infection have all been associated with low vitamin D3. The link to chronic disease, however, is considerably more concerning. Seniors with vitamin D insufficiency were 30% more likely to die from all causes and 50% more likely to get respiratory infections, according to a significant 2020 analysis that was published in the British Medical Journal. This covers conditions including diabetes, heart disease, and even some types of cancer. Your immune system's ability to identify and combat threats is directly influenced by vitamin D3. It boosts your body's capacity to heal injured tissue, boosts immune cells, and lowers chronic inflammation. Because of this, those who have higher D3 levels not only fall sick less frequently, but also recover more quickly. Additionally, D3 promotes mood stability, memory, and cognitive function in the brain. In older persons, low levels have been closely linked to depression and an elevated risk of dementia. Here's the issue, though. The majority of multivitamins don't contain enough to correct the deficiencies that most seniors have. Although 600 to 800 IU should be obtained daily via diet and sunlight, research indicates that most older persons require 1,000 to 2,000 IU daily to maintain normal blood levels. Under a doctor's supervision, you might require even more D3 if your levels are already low, which many are, particularly during the winter. Cholecalciferol or vitamin D3 is the optimum type to take, not vitamin D2. It is more bioactive, more readily absorbed, and more similar to what your body naturally makes from sunlight. It is best absorbed with food, particularly meals that contain fat, and can be taken as a liquid, soft, gel, or pill. The second vitamin, which drives your brain, nerves, and red blood cells, is a much underappreciated substance. However, a large number of elderly people suffer from silent deficiencies, which can lead to memory issues, frailty, and even undiagnosed dementia. Vitamin B12 comes in second. You may already be deficient in vitamin B12 and be unaware of it if you are over 65. At first, the symptoms are mild and include fatigue, memory loss, and tingling in the hands or feet. However, a B12 shortage might worsen over time. It resembles dementia, weakens your legs, impairs your balance, and is frequently overlooked until irreparable harm has already occurred. Red blood cell production, neuron health, and brain function all depend on vitamin B12. However, our stomach's capacity to absorb it from meals diminishes with age. This is because stomach acid, which is necessary to remove B12 from the protein in meat, eggs, or dairy, is produced less frequently in older persons. The issue worsens when common drugs like metformin or antacids are added. The outcome: even if you follow a healthy diet, you may still be gradually falling behind. Nor is this merely a matter of memory. A B12 shortage can also result in falls, shaky walking, and limb weakness. Your peripheral nerves begin to malfunction as a result. Many elderly people believe it's arthritis or simply aging, but it could be something much more straightforward and treatable. So how can it be fixed? Start by reducing your reliance on food. Food-based B12 is not well absorbed after age 60 unless you have a strong stomach acid. Supplemental B12 in the form of methylcobalamin or cyanocobalamin is preferable. These are absorbed straight through your lips or the lining of your stomach. Seniors should take 500 to 1,000 micrograms daily, but depending on lab results, certain individuals may require higher dosages. Because B12 dissolves in water, your body eliminates excess B12. It can be taken under the tongue, as a pill, a sublingual lozenge, or, if you're very lacking, as an injection once a week. Ask your doctor for a B12 test if you are over 65 and haven't had one recently. Since everything else in your body has to work harder, if your B12 is low, it can be the most significant figure in your blood test. Your brain, muscles, and nerves can all work like you're 10 years younger if it's repaired. The most crucial vitamin for persons over 65 is number 1, which comes next. In addition to protecting your heart, brain, bones, and immune system, it was associated with a 36% lower chance of dying from all causes in a significant European study. First up are EPA and DHA, which are omega-3 fatty acids. Although it's not your usual vitamin, omega-3 fatty acids, particularly EPA and DHA, are just as important for adults over 65 as any other nutrient on our list. More research has been done on these essential fats than almost any other supplement available, and the findings are difficult to ignore. Omega-3 fatty acids shield your heart, brain, joints, and even your life expectancy. First, let's talk about the science. The European Journal of Clinical Nutrition published a large research in 2021 that tracked over 42,000 persons over 60. The chance of dying from all causes was 36% lower for those with the highest blood levels of omega-3. Yes, omega-3 fatty acids have been connected to more than simply heart health. They were associated with longer lifespans. According to another published study, seniors who took omega-3 supplements had a more than 45% lower risk of dying from heart attacks. These figures are significant, and the effect on life quality might be considerably more pronounced. To maintain blood vessel flexibility, lower inflammation, create brain tissue, and control heart rhythm, your body requires EPA and DHA. Memory loss, arrhythmias, joint discomfort, and accelerated aging in all organ systems are more likely to occur in older persons who do not consume enough omega-3 fatty acids. Here's the startling bit, though. Simply because they don't consume enough fatty fish or take the right supplements, More than 68% of Americans over 60 have an omega-3 deficiency. The most reliable source? Fish that live in cold water, such as mackerel, sardines, and salmon. However, eating is typically insufficient to provide your aging body with the amount it actually needs. High-quality fish oil supplements can help with that. Choose one that offers a minimum of 1,000 milligrams of EPA and DHA daily. Under your doctor's supervision, you could require 2,000 milligrams or more if you have heart problems or chronic inflammation. Select a formulation that has undergone purity testing, is devoid of heavy metals, and is ideally in triglyceride form for optimal absorption. To lessen the possibility of any fishy aftertaste, take it with food. Additionally, there are great omega-3 pills made from algae that directly supply DHA if you're vegan or have a fish allergy. The benefits of omega-3 fatty acids extend beyond reducing heart attacks and strokes. They improve your ability to mature, think clearly, move more easily, and sleep deeper. They actually assist your cells communicate with one another and establish the structure of your brain. And that's not a luxury when you're over 65. It's essential. Omega-3s are the closest thing we have to a nutritional insurance policy for seniors who want to remain strong, stable, and sharp long into their 70s and beyond. They do more than merely prolong your life. They enable you to remain you for longer. The truth regarding vitamins beyond 65 has now come to light. Some can help you stay strong, think more clearly, and live longer. Others, though, they might be gradually weakening you, clouding your judgment, and endangering your heart. Even when it states that seniors shouldn't take more medication, it's about being more intelligent. For your age, your body, and your future, you require the proper nutrients in the correct form at the right dosage. This entails removing the harmful extras and at last providing your cells with the assistance they require to keep you healthy, active, and intelligent. What is currently in your medicine cabinet then? Tell us which vitamin surprised you the most in the comments section below. If this opened your eyes, hit the like button. Then click subscribe. We dissect the science that keeps you healthier and longer. Please feel free to leave a comment below if you have any queries or would like to share your personal experiences. Thank you for viewing.